Hi guys, welcome back. In today's video, how to heal radiated skin with lasers and LEDs. We're going to be talking about some new clinical studies and new information out there that not only support the use of LEDs, red light therapy, and low-level lasers for wound healing, but they also encourage you to undergo laser treatments to help eradicate some of the broken blood vessels or telangiectasias or redness that you're left with years after treatment. Radiation dermatitis is either acute, which means symptoms can occur a few hours or weeks after treatment, or chronic, which means the symptoms can pop up months, years, even decades after treatment. Acute symptoms usually include an overall redness to the skin that was treated, or sometimes an overall dehydrated, dry feeling, and then sometimes necrosis. And chronic symptoms can include atrophy, fibrosis, and the most common, which is telangiectasia. They look like very small blood vessels that just never go away. Now, as you can imagine, radiation dermatitis is a notoriously difficult thing to treat because the patient is not only sensitive, but the skin has been compromised. So you have to be very, very selective and conservative when choosing some type of treatment protocol. Photobiomodulation, or PBM, is a fancy way of saying light or lasers between 500 and 900 nanometers in wavelengths. With 7 treatments total over 21 days, and the treatment time was like 10 minutes, they found that the group that had the device treatments had an increased regeneration process in the lesions versus the group without. And now if we look at the most common characteristic of radiodermatitis, it's the telangiectasias, those little broken vessels that don't ever seem to resolve on their own. Now, as a medical esthetician and laser specialist, I see a lot of breast reconstruction patients, and a lot of them have these telangiectasias. Now, what I found to work the best is actually a PDL laser, which stands for pulse dye laser, or an IPL, or some type of vascular laser. And what we do typically is kind of lower our energy or our fluence, and we've seen some really great outcomes for this. In fact, there's this study in 2020 from Dr. Anthony Rossi, and I believe he's out of Memorial Sloan Kettering. And this study was looking at the effect of laser therapy on the quality of life in patients with radiation-induced breast telangiectasias. Ultimately, in this study, they found at least 50% improvement in all telangiectasias within 1 to 4 sessions. Now, of course, it's really important to note when dealing with like breast reconstruction patients if they have implants. Sometimes the implants can be placed over the muscle, and then other times they can be placed under the muscle. But when performing laser treatments, especially pulse dye lasers that are much deeper, we have to consider where the implant is located. I personally have had a lot of success in treating radiodermatitis with the BBL handpiece. You can really dial down your settings and your energy, and yes, they may have to come back for more than 4 treatments, but our patients are really happy with the outcome, and I would highly recommend it. Thank you guys so much for watching today. And if you are in fact experiencing some of these symptoms from radiodermatitis, talk to your doctor. Ask them about low-level lasers. See if you can get on a treatment protocol that'll just help you look good and feel better. And until next time, I'll talk to you soon. Bye.